Are you a kidney patient, constantly worried about the hidden dangers in your daily meals? It's a valid concern, as many seemingly healthy foods can quietly elevate your potassium levels, posing serious risks. This guide is here to empower you, revealing 5 common high-potassium foods that could be dangerous for your kidneys, along with clear insights and safer alternatives. Kidney disease profoundly alters how your body processes potassium, making high-potassium foods potentially hazardous for those affected. Consuming too much potassium with impaired kidney function can lead to hyperkalemia, a life-threatening condition where potassium builds up in your blood. This article highlights 5 common foods high in potassium that kidney patients should avoid or strictly limit, with details on the risks, potassium content, and safer alternatives for each. Number 1. Dried apricots. All right, let's kick things off with something many of us consider a healthy snack: dried apricots. But here's the kicker. They pack an incredibly high potassium punch that can actually be quite dangerous for kidney patients. Seriously, just half a cup of dried apricots can contain over 1,100 milligrams of potassium. That's a staggering amount, especially for someone on a restricted diet. In fact, that single serving alone could easily exceed a kidney patient's daily potassium allowance. Now, dried fruits in general pose a heightened risk, and here's why. The drying process takes out all the water, which concentrates all the nutrients, and yes, that includes potassium, into a much smaller, denser package. So, you might just eat a handful of dried apricots, completely unaware that you're consuming the potassium equivalent of several fresh apricots, which, let's be honest, would be far more filling and less likely to be overeaten. This concentration effect makes it incredibly easy to inadvertently consume dangerous levels of potassium without even feeling overly full. It's really sneaky. When we talk about excess potassium, or what doctors call hyperkalemia, it can unfortunately lead to some very serious and even life-threatening symptoms for folks with impaired kidney function. At first, you might notice subtle signs like muscle weakness, tingling sensations, or numbness. But as those potassium levels continue to climb, more severe complications can emerge, things like an irregular heartbeat, palpitations, and in extreme cases, it can even lead to cardiac arrest. Because these symptoms can be quite subtle initially, it's super crucial for kidney patients to be really vigilant about their diet. So, how can you identify other dried fruits to avoid? Always remember this simple rule of thumb. If it's dried, it's very likely high in potassium. This list includes things like dried peaches, prunes, raisins, and dried figs. And a quick tip: always check nutrition labels carefully for potassium content, because different brands and how they're prepared can really vary. Even a small portion of these concentrated fruits can significantly add to your daily intake, so exercising extreme caution here is absolutely vital. Now, if you're looking for some delicious substitutes with lower potassium, fresh fruits are generally a much safer bet. Instead of those dried apricots, why not consider enjoying some fresh berries, like strawberries or blueberries? They're wonderfully low in potassium and packed with antioxidants. Peeled apples and pears are also excellent choices for a sweet and satisfying snack. Just remember, fresh is often best when you're managing potassium, because the water content naturally helps dilute the mineral. All right, with that in mind, let's peel back the layers on another seemingly innocent fruit that can actually pose a significant challenge. Number 2, bananas. Bananas, they're widely celebrated, right? We all hear about their nutritional benefits, but for kidney patients, their potassium level can genuinely be a serious concern. A single medium-sized banana typically packs around 420 milligrams of potassium. Now, while that might not seem excessively high if you're a healthy individual, for someone managing kidney disease, it represents a substantial portion of their daily potassium limit, which, for many, is often around 2,000 milligrams. What makes bananas particularly tricky is that they're often a hidden potassium source in so many common dishes and snacks, making them tough to avoid. Think about it. They're a staple in breakfast smoothies, giving us that sweetness and creaminess, but also adding a considerable potassium load. You'll also spot them in all sorts of baked goods, fruit salads, and of course, as that quick, convenient snack on their own. Unknowingly, eating bananas in multiple forms throughout the day can very quickly lead to an unsafe accumulation of potassium. And honestly, that's a common oversight for many patients. The big challenge with finding good substitutes for bananas really comes down to their amazing versatility and popularity. It can be genuinely difficult to just swap them out for lower potassium fruits when bananas are so integral to a recipe's texture or flavor profile. However, understanding when to make that switch is absolutely crucial. For example, in smoothies, instead of a whole banana, you might use just a smaller portion, or better yet, opt for low potassium fruits like berries or peaches. In other recipes, you could consider unsweetened applesauce or pureed pears for moisture and sweetness, especially if that distinct banana flavor isn't essential to the dish. So, managing fruit intake when you have kidney disease truly requires careful planning and awareness. It's not about eliminating all fruits, not at all, but rather choosing those that are lower in potassium and being super strict with your portion sizes. Small portions of certain fruits, even ones that are moderate in potassium, might be permissible on occasion. Make sure to prioritize fruits like grapes, apples, pears, and berries. And always discuss your fruit choices with your healthcare provider or a renal dietitian to get recommendations tailored to your specific needs. Understanding your individual potassium limits is absolutely key to making safe and informed dietary choices. Next up, we're going to delve into another healthy food that quite often surprises kidney patients with its hidden potassium content. Number 3, avocados. Avocados. They've gained immense popularity, haven't they? Often hailed as a fantastic healthy fat source. But for kidney patients, their potassium content can be surprisingly high and, frankly, quite problematic. Just a single medium-sized avocado can contain well over 700 milligrams of potassium. That's a significant amount that can quickly contribute to hyperkalemia in those with impaired kidney function. This actually makes it one of the highest potassium fruits available, even though many of us tend to think of it as a vegetable. Avocados are enjoyed in so many popular ways, from those trendy slices on toast to creamy guacamole, and each form carries its own unique risk. Eating a whole avocado, or even a generous serving of guacamole, can so easily push a kidney patient over their daily potassium limit. Guacamole in particular often has other potassium-rich ingredients like tomatoes and cilantro, which can further escalate the danger without a patient even realizing that cumulative effect. The fact that they're so easy to overeat due to their appealing taste and texture really just adds to their risk. Now, there's a really common healthy food misconception that surrounds avocados, especially for kidney patients. Because they're rich in monounsaturated fats, fiber, and various vitamins, they're often touted as a superfood. But here's the thing. What's healthy for the general population might not always be appropriate for someone with a specific medical condition like kidney disease. It's absolutely crucial for kidney patients to understand that healthy does not automatically mean kidney-friendly, and general health advice really needs to be filtered through their specific dietary restrictions. So, what about safe portioning? If avocados are allowed at all, the advice is to consume them in very small, infrequent amounts, if you can have them at all. For some, even a small portion might actually be too much, depending on their individual potassium levels and kidney function. If your healthcare provider or dietitian does approve a tiny serving, it might be limited to just a mere tablespoon of mashed avocado or a few thin slices, and truly, only on rare occasions. Strict adherence to portion control and careful monitoring of your blood potassium levels are absolutely paramount when considering any high-potassium food. Always, always prioritize your doctor's advice over general health trends. And now, let's explore a common kitchen staple that often flies completely under the radar for its potassium load. Number 4, tomatoes and tomato products. Tomatoes and their many processed forms are absolutely everywhere in diets worldwide, yet their potassium concentration can actually be a silent threat to kidney patients. A medium-sized fresh tomato has about 290 milligrams of potassium, which is moderate. However, here's where it gets tricky. The potassium concentration significantly increases in processed tomato products. For instance, just half a cup of tomato sauce can have over 500 milligrams. A cup of tomato juice can exceed 550 milligrams, and a small can of tomato paste can contain well over 800 milligrams of potassium. This really makes them particularly hazardous for kidney patients. The sheer prevalence of tomato-based sauces and products in common diets truly makes them difficult to avoid. They're foundational to so many Italian dishes like pasta sauces, pizzas, and lasagna. But you'll also find tomatoes in soups, stews, chili, ketchup, and honestly, a ton of prepared meals. Without really careful label reading and conscious meal planning, a kidney patient can so easily consume high amounts of potassium through these everyday ingredients without even realizing it, quietly accumulating dangerous levels throughout their day. It's really important to understand how cooking and processing affect potassium levels in tomatoes. While some nutrients can be lost or changed during cooking, potassium is a mineral and generally remains stable. In fact, when tomatoes are processed into sauces, pastes, or juices, it actually concentrates the potassium because the water content is reduced. This means that a small serving of tomato paste, for example, delivers a far higher potassium punch than the equivalent amount of fresh tomatoes. This concentration effect is precisely what makes processed tomato products especially risky. Now, when it comes to safer recipe modifications, creativity is absolutely key for kidney patients. Instead of relying on those tomato-based sauces, consider using lower potassium alternatives. Cream-based sauces, perhaps made with low phosphorus, low potassium milk alternatives, or even just simple white sauces, can be a great substitute for pasta. For flavor, really lean into herbs and spices like oregano, basil, garlic powder, and onion powder, which are naturally low in potassium. If a recipe absolutely needs just a touch of tomato, use a very, very small amount, dilute it, and make sure it fits within your daily potassium allowance. Always prioritize fresh, low-potassium vegetables and try to avoid highly processed tomato items whenever possible. And now, let's consider a staple in many fridges that's quite often overlooked as a significant potassium source. Number 5. Milk and dairy products. Milk and dairy products are so often associated with calcium and bone health, right? But what many don't realize is that their potassium load can actually be a significant concern for kidney patients. A typical 8-ounce serving of milk, whether it's whole, skim, or 2%, contains approximately 350 to 380 milligrams of potassium. Now, while this might seem moderate per serving, dairy products are consumed frequently and in various forms throughout the day, which can easily lead to a cumulative high intake that becomes quite problematic for compromised kidneys. The risk from other dairy products like cheese and yogurt is also quite substantial. While hard cheeses generally have lower potassium per serving compared to milk, larger portions can certainly add up. Yogurt, especially plain varieties, can contain similar or even higher amounts of potassium than milk, often exceeding 400 milligrams per cup. And watch out for flavored yogurts with added fruit or other ingredients, as they might even contain more. Things like ice cream, cream cheese, and even some butter can also contribute to your overall potassium burden, making it challenging to track your total intake. It's interesting, but dairy is often overlooked as a potassium source because the main dietary focus for kidney patients usually tends to be on phosphorus and calcium when it comes to dairy. However, potassium is truly just as crucial to monitor. Think about it. Many people consume multiple servings of dairy daily, milk in their coffee, cereal, yogurt for breakfast, cheese in sandwiches, and ice cream for dessert. Each serving adds to that total, and without careful attention, these seemingly harmless additions can very quickly elevate blood potassium levels to dangerous ranges. Fortunately, there are some great lower potassium alternatives that can help kidney patients still enjoy those creamy textures and familiar flavors. Rice milk, for instance, is a good low potassium option for beverages and cooking, typically containing less than 50 milligrams per cup. Unsweetened almond milk is another excellent choice, usually having around 160 milligrams of potassium per cup, making it a very viable substitute for cow's milk in many recipes and for your cereal. When choosing any alternatives, always read labels carefully, as some brands may surprisingly add potassium or phosphorus. Using these alternatives really allows for more flexibility in managing your daily potassium intake while still enjoying a varied diet. So, we've covered the big five, but what else should you be keeping an eye out for? Let's talk about other high potassium foods and those tricky hidden sources. Other high potassium foods and hidden sources. Beyond the top five we've just discussed, there are several other common foods that are notably high in potassium and really should be approached with caution by kidney patients. Think about potatoes. Especially when they're baked or roasted with their skins, they're significant potassium contributors. Beans and legumes, things like black beans, kidney beans, and lentils, are also quite rich in this mineral. Orange juice, along with other citrus juices, often contains high levels of potassium. And certain meats, particularly processed meats, or large portions of red meat, can also add to that potassium load you're trying to manage. It's also absolutely crucial to be aware of potassium lurking in supplements and especially in salt substitutes. Many dietary supplements, particularly electrolyte blends or those marketed for muscle support, contain substantial amounts of potassium. And a huge warning, salt substitutes often replace sodium with potassium chloride, which can make them extremely dangerous for kidney patients, as they can cause a rapid and severe increase in potassium levels. The importance of reading food labels, my friends, truly cannot be overstated. Always check that nutrition facts panel for potassium content, even in foods you might not expect to be a source. And understanding serving sizes is equally vital, because consuming more than the recommended portion can quickly turn a low potassium food into a problematic one. Vigilance and informed choices are truly essential for managing your diet effectively. Managing potassium in the renal diet. Effectively managing potassium when you're on a renal diet is truly a collaborative effort between you and your healthcare providers. Your doctor, working hand in hand with a registered renal dietitian, can give you personalized guidance based on your specific kidney function, your blood test results, and your overall health. They're there to help you understand your individual potassium limits and to develop a safe and effective meal plan that works just for you. Regular periodic blood level checks are a real cornerstone of managing potassium for kidney patients. This regular monitoring allows your healthcare team to accurately assess your current potassium levels and make any necessary adjustments to your diet or medications. These tests really do provide crucial insights into how your body is handling dietary potassium and help to prevent dangerous fluctuations. It's absolutely vital to understand that managing potassium is a highly individualized approach. There is simply no one-size-fits-all solution here. What works perfectly for one kidney patient might not be suitable for another. Your dietary recommendations will genuinely depend on specific factors like your stage of kidney disease, whether you are on dialysis, and any other coexisting health conditions you might have. Always rely on personalized advice from your medical team rather than just general dietary guidelines you might find. There are also some simple tips that can really help reduce potassium in your meals. For instance, paring or peeling fruits and vegetables, like potatoes or apples, can remove some of the potassium that's concentrated just under the skin. Leaching, which means boiling vegetables in a large amount of water and then discarding that water, can also help reduce their potassium content. But perhaps the most critical tip of all is portion control. Even low potassium foods can become problematic if consumed in large quantities. So, being mindful of how much you eat and how often is truly key. So, to wrap things up, high potassium foods can indeed have serious consequences for kidney patients if they're not carefully managed. Being aware of these hidden dangers and making routine dietary adjustments are absolutely essential to avoiding complications like hyperkalemia, which, as we've learned, can be life-threatening. Always seek guidance from a healthcare professional, especially a renal dietitian, before making any major changes to your diet, just to ensure your choices are safe and perfectly tailored to your specific health needs. If you liked this guide to high potassium foods, please consider sharing it with your loved ones who are managing kidney disease to help spread this vital awareness. And hey, leave a comment below with your own tips or questions. We'd absolutely love to hear from you. Don't forget to subscribe for more expert renal nutrition information and to support our mission to empower better kidney health.